Good morning, good afternoon, good evening, good night to everyone, wherever you are watching us. Welcome to the CPD Talks. This is Professor Burak Buldur, and we are now beginning the third episode of CPD Talks with one of the most inspiring clinician, a leader name, a professor of orthodontics, a lecturer, a mentor, an invited speaker in many countries from all over the world, a very beautiful lady, a great researcher, a great academician from Brazil, my dear friend, Patricia Valerio. Hi, Professor, how are you?
Hi, my dear. It's very good to have you here and to have the opportunity to talk with you and discuss things that we like to do. You and me, we like so much to deal with the type of things that will promote health to our children. So it's nice to be here with you.
Yes, every children needs good health, and we should help them. Professor Valerio has an inspiring career and unique pediatric dental practice experience, especially within the issue of functional jaw orthopedics. So we will begin. The topic of today is functional jaw orthopedics and pediatric dentistry. We should dive into the core of FJO and explore how it is principles seamlessly blend with pediatric dentistry, of course, to foster not just oral health, but holistic development in children. We should shed some light on this integration and its foundational theories. So here is the question. Can you explain the fundamental principles of functional jaw orthopedics and how they integrate with the broader field of pediatric dentistry?
Of course. This is my favorite subject. I cannot understand jaw functional orthopedics without pediatric dentistry and the opposite also. I think we must work together because we integrate both specialties to promote health, as I said. And the fundamental principles of this are based on the promotion of function. That's why it's called so functional orthopedics. Someone call functional jaw orthopedics. I prefer to call jaw functional orthopedics. Why? Because functional orthopedics can be made in all the body. We can stimulate growth in all the body. And when we focus on craniofacial region and mainly on the jaws, so we have a special opportunity to deal with a special kind of bone, with special kind of growth and development. So that's why I prefer to call jaw functional orthopedics. Okay, and the journal, we have one journal about that published some research about that, and the name of the journal is Jaw Functional Orthopedics and Craniofacial Growth. So just to reinforce this concept. Anyway, what is the main principle, as I said, is to recover the function. Why? Because function leads to form. And it comes from many, many years. So it starts with Julius Wolff and Wilhelm Hooks in the 80s. So, not 80s, 18s. So we have to understand this, that the craniofacial region never will grow properly if we don't execute correctly the functions that the system are supposed to do. So we need to breastfeed. We need to breathe by nose, we need to masticate, and all the functions. And there is something interesting that normally I ask Burak, because I think that the majority of dentists doesn't know how many functions the stomatognatic system has. And we have 21 functions. And our objective as jaw functional orthopedists is to promote the correct functioning of all these 21 functions. So this is the base of jaw functional orthopedics. We start early and we can work even with old people, but our main aim is focusing on the child.
What was the motivation source for choosing this topic? Was there any mentors that played a crucial role in developing or in researching this topic, or maybe bad experience in your childhood or your in people you love? What was the most important motivation? Why did you focus on this topic, jaw functional orthopedics?
Yes. So I started being orthodontics, traditional orthodontics. And I was this is many, many years ago, more than 30 years ago. And I was extremely frustrated because the children arrive to my office and I see a lot of problems on the development of the occlusion and the development of the face. And I didn't have any therapeutic arsenal to deal with that children. So I have to say to them and to the parents, let's wait. We will do something later. And my heart was completely broken when I had to do this at that time. So I started to search for some therapeutics that would allow me to see that children, to help them and to promote the correct growth. So this was the big motivation that made me go searching until find my big masters.
Yes, we are lucky you have chosen this way. So that was the biggest motivation. Observing the transformation in children, in patients through the jaw functional orthopedics treatments must be incredibly rewarding, of course. From your extensive experience, could you highlight the most striking long-term benefits that have stood out, particularly those impacting oral health outcomes? So here is the question. What are the most significant benefits you have observed in patients undergoing JFO treatments, particularly in terms of long-term oral health outcomes?
Okay, so let's start from the beginning.
Sure.
Jaw functional orthopedics start as soon as the baby is born, and today we are working hard with the pregnancy counseling. So we receive the mother before the baby is born. Sure. In our office to explain to the parents the relevance of correct execution of some functions, not only breastfeeding, but also the relevance of promote the correct nose breathing and the correct introduction of the food. Okay, today the majority of jaw functional orthopedists they use the BLW method of food introduction because we know the relevance of having hard food as soon as possible to the babies. Even when they don't have teeth yet, we need to teach the parents how to introduce this to stimulate correctly the proprioception of the mouth. So people doesn't know what is proprioception. And to allow a correct mastication, we have to start stimulating the proprioception of the mouth as soon as we can. And it is extremely important to explain this for the parents early. And also to discuss the use of not of pacifier, and if we use pacifier, why we have to remove it as soon as possible. How can we make this use more functional than something that can create problems? So this we start to make before the baby is born. After the baby is born, we start with our concepts, dealing with the direction and the examination of the gingiva.
Yes.
We need to check it. And if we have some alteration on the relation of the gingiva of the babies, we stimulate with some massages and things like that, teach the mother, and go on. Also, we reinforce so much the relevance of putting the foot on the floor or on the chair, having the foot support to stimulate the correct functioning of the mouth, because normally people put babies, sit, and the legs are like that.
Yeah.
So we cannot have the correct posture of the mouth, and so on. Then we start to see later if we have some problems with very simple approach like selective grinding on temporary dentition. Later, direct tracks. We use direct tracks very often to guide the movement of the mandible and stimulate the correct growth of the mandible and maxilla and the face. And if necessary, we go on to use appliance, and we can use appliance very early. And the babies, the children, they accept. And sometimes, Burak, people ask to me, are you crazy? How can you put an appliance in a 3-year-old baby? The baby is not used. And I say, yes, they will. If it is correctly indicated, they will. You know why? Because the appliance gives comfort for them. They are not able to describe that they feel some discomfort. And when you put the correct relation from mandible and maxilla, they feel comfortable. They use more than old children because they feel comfortable and they stay with the appliance in the mouth if it is necessary. I'm not saying that we have to treat all the patients at 3 years old. I am saying that if a 3-year-old baby needs an appliance, this baby will use, because this child will feel comfortable with the appliance in the mouth. We have enormous experience with this, okay? And of course, later we use for different type of approach. And the most important thing is that we don't need to finish with orthodontics. People still have this misunderstanding about jaw functional orthopedics. They think that we work in some phase, and then we have to go to fixed orthodontics or to aligners to finalize the case. It's not true. Okay, we can finish perfectly the case if we start to work in the correct time.
2 fast questions, right? You talked about pacifier.
Yeah.
Never suggest, or after 1 year, after 15 months.
No.
What is your recommendation for parents?
Yeah, my orientation is you can use to calm down the baby, because some babies need to suck more than they suck the breast.
Sure.
Sometimes we when the mother is all the time with the baby and they can go to the breast when they want, they will not need the pacifier. But the majority of the cases are not like that. So the pacifier can be used in some moments, not stay all the day with the pacifier. And we must remove as soon as we realize that the baby is achieving maturation, psychological maturation, okay? So when, depends, can be from 1.5 to 3 years, depends on the psychological maturation.
I think you talked about 3-year-old children needs these kind of treatments. I think the main rationale of this treatment is mouth breathing, of course.
Yes.
Which appliance you use in these very young children? Mostly, which appliance, which kind of MyoBrace, others?
No,
What
I
is?
don't use. No, I don't use MyoBrace. Okay. Sometimes people ask me, "What's your opinion about MyoBrace?" And
Yes.
I used to say, "It's better MyoBrace than nothing." Okay, so if you don't know what to do and put MyoBrace, okay, it's better than do nothing. But if you know jaw functional orthopedics, you don't need MyoBrace because MyoBrace standardize everybody. Everybody has the same size of mouth, the small, medium, and big. So it's not individualized. Okay, which kind of appliance we can use for a 3-year-old baby? We can use an appliance to get transversal growth that we call PIPE sometimes, in some case. We can use appliance that change the posture of the tongue, and we call it SN2 or SN3. So it will depend on the problem that the patient presents. And of course, if the baby has nose breathe, perfect. If doesn't, we need to work together with the otorhinolaryngologist, of course, and or pediatrician, but we need to work together. There is no meaning on putting an appliance here if the nose is not working, because the roof of the mouth is the floor of the nose, is the same wall. So we need to work together.
Yes, it's very important to collaborate with ENT physicians. So timing is very critical in orthopedic interventions, especially in growing children, as you talked about. Based on your extensive experience, what is the ideal age to start evaluating? You actually talked about from the birth, maybe earlier. So here is the question. Maybe you can talk about tips and tricks regarding this question. How early do you recommend assessing children for potential JFO interventions, and what are the key indicators you look for? Please answer this question for young colleagues, maybe, or general dentist.
Okay.
Maybe some patients go to for routine control for them. What should we look as dentist in a child, in a baby?
Okay. First thing you have to look, lip sealing. So if you don't have lip sealing, you have malocclusion. Yeah. Always. And if you have also tongue tie, real tongue tie, you will have malocclusion. Why? Because this is what I would like to talk to our friends that are starting.
Yes.
What determines the position of the teeth in the mouth? So this is the most important thing that we have to put in our mind. Is the tongue forcing outside and the perioral muscles forcing inside. The equilibrium between these two forces will give the correct inclination and the position of the teeth. So if a baby has huge tongue tie and the tongue is not able to force the palate, of course we will have deep palate and tendency of crossbite, of course. If you don't have lip sealing, the teeth will be forced out more than necessary, opening diastema or creating overjet, depends on where the tongue is forcing. So the critical thing is to evaluate the functioning of the muscles and the execution of the functions in general. How the baby is masticating, how the baby is swallowing. So we have to observe this. This is our duty, us as dentists, not only as functional orthopedics or pediatrician. Everybody has to pay attention on that.
Okay, thank you very much for these great tips. Dental procedures can be very daunting for children, affecting their mental and emotional state, of course.
Yes.
How have you seen JF or techniques not only address physical oral health issues, but also positively influence the psychological and emotional comfort of children. So here is the question. In your experience, how the JFO techniques impact the psychological and emotional well-being of children in terms of oral health related quality of life, of course?
Coincidentally, we had published a paper together with two friends of Turkey.
Yes.
About this subject, the influence of malocclusion on the psychological aspect of the children. And we showed two cases from Turkey. One was a boy that had a terrible class 3. He was like that. And he suffered a lot of bullying in the school, and he became kind of clown. He used to make a lot of things to draw the attention for him and to masquerade the problem that he faced. And Shule Chinchek treated him very early with direct drugs and things like that. And his grades on the first school changed completely when he had a new smile and the self-esteem was he gained. He changed completely his behavior, and he started to be more happy dealing with the colleagues and things like that. And the other one also was the opposite, like that, a class 2 patient, terrible class 2 patient. And he also had terrible performance on the school. And after treating very early, he changed completely, and he grew up very competent on the school. So, and we also see it very, very easily in the literature. Do you know Dr. Saul Paiva? You know him, Dr. Saul from Brazil is the,
Chief of Brazil, right?
Yeah. This is a great pediatric dentist, and he published our work some times ago about this subject, and he made a big investigation, and he said that with 5 years old, the children are completely influenced by the aesthetic of the teeth. 5 years old. Okay, so they can change completely the behavior due to alteration on the smile, due to presence of caries, and they feel themselves ugly, and they change completely. So, and he said that malocclusions influence too much the self-esteem of the 5 years old children. So this is very important.
Luckily, you are giving great attention on preschool children.
Yes.
But many orthodontists actually maybe not giving enough attention on these children. Maybe you experience this issue in Brazil too. Many of them argue that we can handle everything after 12 years old, after mixed dentition and permanent dentition. What do you think about this issue?
The question is, I will explain you why it happens. Orthodontists, and when I say this, I say free because I am also an orthodontist.
Yeah, sure.
So orthodontics normally focus on teeth.
Yeah.
And teeth you can correct even with 80 years old. If you have periodontal ligament, you can move teeth with 80 years old, no problem. The question is, the problem is not the teeth. We are talking about growth and development, and the teeth are consequence. So that's why they don't mind. They know that we will align teeth, but I am not talking about aligning teeth. I am talking about promoting the correct craniofacial growth. It's completely different. Okay?
We face this problem in Turkey, unfortunately.
I know.
In Brazil, too, in all over the world. I hope they change their mind. They're inspired.
Yeah.
They get inspired by you. So, innovation drives progress in all fields of dentistry, also including the JFO. Could you discuss any recent advancements that have significantly influenced your treatment approach, enhancing both process and patient outcomes? So, here is the question. Can you discuss any recent advancements or innovations in the JFO that have transformed your approach to treatment or patient outcomes?
Of course. Everybody works with workflow. And it's very easy to do some approach when you're scanning the mouse, the children accept this very well to make the scanning, and then you can print the model and you can prepare things also on the computer, like direct tracks, for example.
Yeah.
You prepare the direct tracks on the computer, you check everything, then you print the models, you make some plates, and then you transfer direct to the mouse. So you will take 15 minutes with the baby, and you are able to make very well adjusted direct track. So this, for me, was the most important thing that happened to make our work easier and to be able to work even with some children that doesn't allow us to make impression and things like that. So this is the most important. And also some appliances are made also using workflow. So we are improving. I am not talking about aligners. Aligners are orthodontics. I am talking about functional appliance and direct tracks made by indirect method using workflow.
Is digital technology, digital dentistry, 3D printers, other things in your routine dental practice, or sometimes you use it?
Nowadays, I am not using so much the impressions.
Yeah.
Okay, so only scanning and impression, make the impression of the models to give more comfort to my children. Okay.
Yes, both of the dentist and the children, I think it should be in the routine practice.
We need to make impressions. I can make it without any problem using quick cure alginate. This is extremely important. Always use quick cure alginate, because it will delay less than 2 minutes to get cure, so you can play something with the children, and also make exactly the correct choice of the trays, because sometimes we use short trays and we have to repeat. So we need to use correct trays. So then the traditional way is not forbidden, of course not. We can use it and get good results with this, no problem.
Thank you very much. The synergy between different specialties can often be the key to comprehensive patient care, of course. How do you cultivate interdisciplinary collaboration within the realm of FJO and pediatric dentistry, and what impact does this have on treatment success? So here is the question: what role does interdisciplinary collaboration play in the successful implantation of JFO in pediatric dentistry, and how do you foster these relationships?
Okay, so first of all, here in Brazil and in many countries, we have a very well developed speech therapists.
Great.
Okay? That deal with children, that teach them how to perform better the function. So they are very interesting collaborators for the success of jaw function orthopedics. In the same way, we need osteopaths. Osteopaths are very, very important also, because we can adjust the treatment that we are making here with the treatment that the osteopath made in the body, because we cannot sectionate the body. Everything is connected. And when we change here, we change the cervical, and changing the cervical, we change the posture, you change even the way of children put the foot on the floor. So if we have the opportunity to work with an osteopath, you are in the heaven, because the treatment goes quicker and everything will, and of course, pediatrician, and of course, otorhinolaryngologist. But we need otorhinolaryngologist that speaks our language, because sometimes you send the children and they say, no, as the immunity improves, this will improve, we don't need to make anything. Yeah, but when the immunity improves, the children has a lot of alteration on the growth. So we need otorhinolaryngologist that speaks our language.
It is very hard. Especially the pediatricians have very low level of knowledge about oral health or concomitant issues. I hope they give some importance and attention on dentistry, on teeth, on jaw, other things.
Yeah.
Education is very important, plays a pivotal role in acceptance and success of JFO treatments. How do you navigate the conversations with parents? This question is very important. How do you navigate the conversations with the parents or caregivers about the benefits of necessity of these treatments, and what challenges have you seen in these discussions? Here is the question: how do you approach educating parents and caregivers about the importance of JFO treatments? It is very, very, very hard to tell parents that your child should use this appliance in 3 years old, 4 years old.
Yes.
How do you communicate with them about this issue?
Okay, so we have to separate different cultures. Okay, here in Brazil, it's not difficult anymore, thanks to God. Okay,
Great.
Parents come to us because they are aware about one open bite, little open bite, or they realize that the children has a cross bite. So nowadays here in Brazil, it's not a problem. But when they come, I explain exactly what is the correct way and why the things are going out of the correct way. And the most important thing I consider, and what I teach for my students from other countries and other cultures, is you need to use visual things. So you need to have a computer with a lot of images to explain to them what we are talking about, because they are not supposed to understand. They are not dentists. They are not doctors. So if you have a lot of images, you can explain better to them. And I will give a tip also. As I said before, we need to show them that everything is connected. The body is one. So I use so much the podoscope. Do you know podoscope? Where we put the children over and see the impression of the feet?
Yes.
Yeah. So I have a podoscope, and the parents are completely amazed with that, to see that, because I put the children there and I say, look, if you, and I ask the children, make this, and the foot changes. Understand?
Wow.
So I can explain to them that the things are related, and the posture of the body is dependent on everything working properly. So everything that we can use to show visually for the parents is important, because of course, each parent wants the best for the children. And they think that appliance will cause suffering for the children, that intervention will cause suffering. You need to show them that is exactly the opposite. So this is what I advertise to my students from places where they face resistance with.
This needs a great documentation.
Yeah.
Follow-up. Do you have any protocol for dental photography or intraoral, extraoral radiography? What do you do when a patient comes to you?
Intraoral, extraoral photography, of course. Now I am using the cell phone because we have good programs to use. And I take extraoral pictures using reference. So I use the symmetrograph to take the picture because it's important also. It's good that you asked it because we can show to the parents, look, the shoulder of your children is like that. Look, the head of your children is like that. They didn't realize. And if you don't have a reference mark, nobody realize it. So it's extremely important. And we also have some grills that we use to put on the PowerPoint to make segmentation of the pictures to show the parents. So it's extremely important. And X-ray, normally we use Ceph, not make cephalometrics for children, only the teleradiography to see the lateral view and the pan. If possible, tomographic, okay, but it's not necessary. We can use only these two.
Not mandatory.
Yeah.
All right, thank you very much. We know that every patient, every child presents a unique challenge, especially in complex cases where JFO can make a transformative difference. Yeah. So, can you share a particularly challenging case where JFO made a significant difference in the patient's treatment outcome, and what lessons you have learned? Do you remember? Do you have any patients you used to remember?
Yes, there is an emblematic case. There was a child with 2 years and 9 months.
2 years.
Okay? Yeah. And the child has a terrible deviation on the mandible. One side has a broady crossbite, and the other side was not crossed. It means that the maxilla was big and the mandible is smaller. Yeah. And to achieve maximal interexpidation, this child has to make this. So the midline deviation was 1 teeth midline deviation, 2 years, 9 months, okay? So we checked this child and what can we do? Dr. Christina, my friend, was working on this. So we realized that it was impossible to make tracks. The discrepancy was too much. So we need appliance. So let's make an appliance for this child. Which appliance? An appliance, I forgot to say that she also has a terrible deep bite. It was something terrible. So we construct an appliance that solved the deep bite, centrate the mandible because it was positioned, centrate the mandible, block the maxilla, and stimulate the mandible. Okay? A simple appliance, but with all the concepts on it. And as I said to you, we put in the mouth of the baby. And she was completely in love with the appliance. Why? Because she has to make this and to stay all the time like this. It was not comfortable. But she could never say this because she never realized what is going on. Suddenly, we put the appliance and the muscles recover the correct size and relax more. So she was in love with this appliance. It was difficult to ask her to remove, to eat, because she had to remove to eat. She was in love. And of course, she was in the phase of development, oral phase, that stimulate more the presence of the appliance was perfect. Anyway, in less than 2 years, we finished this case. And this girl, we have the follow-up of her. Today, she has 20 years old, okay?
Right.
And she never need one brace, anything. Only use during from 2 years and 9 months to 4 years something, okay? So she used less than 2 years of appliance in this age. And after this, just going on under supervision, mastication and nose breathe, nothing more. Today, she has a wonderful smile, and we use appliance in the necessary moment, never more. So this is the most emblematic case that I have, because it is clear that jaw function orthopedics must be made as soon as you detect something wrong. And then you promote the correct growth and leave the nature work.
I think the main key is the timely intervention. Yes?
Yes, yes.
When we see the problem, we should make the timely intervention.
What is the time? When you see something wrong.
Yes.
This is the time.
This is the take-home message for all items. It should be great to see the happiness of a baby, of a child, 3 years old child, the parents. It would be very nice to see their smiles.
Yes.
They are lucky. They are very lucky to meet you. Dentistry is an evolving discipline, occupation. As with an evolving field, there are always areas ripe of exploration. From your perspective, what are the most significant gaps in the current research or understanding the jaw function orthopedics, and where should future studies be directed? So here is the question. What are the biggest gaps in current research or understanding related to jaw functional orthopedics, and what areas are the most ripe for future investigation?
Well, the big question is to prove for the ones that doesn't believe that it really works. So we need to make research comparing evolution of the case, but this is extremely difficult, extremely difficult. Why? Because you can cause some prejudice for the ones that will not be treated, just to make a follow-up. So we can make a retrospective work, okay, but it's not so good as if we make a prospective work. So the most challenge point today for us is the correct design of the research to reinforce the effectiveness of jaw function orthopedics. Okay, this is the most challenging, and also there is a challenge point that is not related to pediatric dentistry, is related to dentistry in general. That is the effectiveness of jaw function orthopedics even in adults, because we still think that we can use only when we have growth, and it's not true. We can use functional approach even after finishing the growth, because the bones that form the stomatognatic system are special bones, and they answer to stimulation forever. Of course, if you have growth, the answer will be quicker, but it doesn't mean that you will not be able to work later. And this is a big challenge for us also to prove this.
Yes, it's a very challenging issue. You have an institute right? Am I right?
Yes.
Great. In Brazil, you are an invited speaker in more than 10 countries. Luckily, one of them is Turkey.
Yes.
You have some collaborators in Turkey. Can you tell us who you work with in Turkey? Who are they? What they do? What can Turkish dentists or other dentists from different countries can reach your courses, seminars, maybe
Yes.
education programs?
I also developed online education because of that. So I have in English for English speakers. I have a course to train them to work with jaw function orthopedics. And in Turkey, we have Biofocus is an institute that it's a not institute. I don't know how to say the name. They promote courses, okay, and
Okay.
I give course for them, but since the pandemic time, I am teaching only online because now we have people that know jaw function orthopedics enough in Turkey to teach. And some of Turkish people went to me in Portugal and make the specialization course on the institute in Portugal because I used to teach there also. And they made 2 years course there in Portugal. Many students from Turkey. Anyway, we have to spread the knowledge because this is for benefit for our children. So we have to spread this knowledge. We just want to promote the correct growth and make the things easier. We don't need, you know, we have a big problem. We don't use many infrastructures from industries. So we just use knowledge, wire and acrylic. So this is our big challenge because we don't give money for the industries.
Do you have any book? Did you write any book?
Yes, 2 books. One is in Portuguese and the other is Portuguese and English. Let me show. May I?
Yes, please. We would be very happy.
So this is the book, Form and Movement, okay? And it is written in Portuguese and English. Okay? So, this is the physiological basis of jaw function orthopedics. I am very proud of this book because every single paragraph has reference. There is nothing here that I think is completely supported by science. So this is why I love this book. This is my young son.
Yeah, sure. What is the publisher? Do we know?
It's Tota. They sell all over the world.
Okay.
Can we
see the image of the first page?
Yes.
Okay. Maybe who are watching and who will watch this record would like to get a copy of this. Thank you very much. It looks great. So you are the queen of jaw functional orthopedics.
No, I am this age.
True, is true. I think. Looking for the future. You are a mentor. You are a master. The field of jaw functional orthopedics is on the cusp of exciting developments. How do you envision JFO evolving within pediatric dentistry, and what opportunities or innovations are you most looking forward to or witnessing? So here is the question: how do you see the field of JFO evolving within pediatric dentistry? What are the most exciting opportunities on this horizon?
Yes, you know, I am very, very happy because I started to coordinate the first master degree in jaw function orthopedics at the faculty here.
Wow, great.
So,
great.
Yeah. So I have a Brazilian group, and in July I will start a second group from students from all over the world. So I have students coming from France, from Romania, from Russia, from United States, from Turkey. So 12 students will start the first master degree totally focused on jaw function orthopedics. It's the first in the world, and I am very glad that I am coordinating this.
It will be in Brazil, right?
Sorry?
It will be in Brazil, right?
Yes, Brazil. Yeah, and it's and it is a hybrid. Hybrid. So some modules are online, some modules are presential. So I am very glad to announce this because it was a big fight to achieve this possibility.
Yes, I can guess.
But we did. We did it.
You are great. You are great. And I'm sure that you have a great team. Who is in your team? You would like to mention, you would like to thank, or who is in your guidance?
Yes. In Turkey, I would like to mention Banu Yeşilbek.
Yeah.
Okay. Yeah. She is my daughter.
Great.
Scientific daughter, and also like a daughter also. And in France, I would like to cite Dr. Philippe Hall. He is amazing. He has an institute there teaching jaw function orthopedics. In Portugal, we have the Vilma Simões European Institute that teaches jaw function orthopedics. It's a very important school there. And in Italy, we have very good functional orthopedists in Torino University.
Great.
In July, I will be there to give a lecture there at the university. So we have very good people there. I have to thank them for the collaboration with me all over the world and my team here.
Yeah, great. You are great. We are very lucky, not only pediatric dental community, but also not Department of Orthodontics, but also the concomitant disciplines of dentistry. You are a great mentor because doing something is not always very rewarding, but teaching, inspiring should be always a great feeling. You have many students from many different countries from all over the world. Thank you very much for being a very important figure in dental community. Not only helping these children get a better face, get a better smile, but also inspiring many colleagues from all over the world. Thank you very much for giving us this opportunity to the CPD talks to listen to you. We have many thanks messages. Maybe you know Dr. Marcos Nadler-Gribel, Dr. Marta Coelho, Dr. Fiona Noah. Thank you very much for them. You are the queen. You should accept this. You are the queen of jaw functional orthopedics. It was very nice to talk to you in ICCPD in 2021. You remember?
Yes.
It was our great honor, great pleasure to meet you. So second time we are in CPD talks. I'm very happy. I'm very pleasured and honored to talk to you. And I think we should meet you in Turkey, maybe in a face-to-face event, face-to-face congress.
Yes,
maybe.
I'm good for that.
Yes, we would like to welcome you in beautiful Istanbul. Thank you very much for sharing your very valuable time with us. So I can give the floor to you for the last few words. Thank you very much.
Okay. I would like to thank you so much for the invitation. It's a great opportunity for me because if you ask me, what do you like to do? I like to talk about functional orthopedics. This is the most amazing thing in my life. So having this opportunity was very important to me. Thank you so much. and mainly coming from someone from Turkey. That is my second country.
Yeah, great, great,
Yeah.
great. We will.
So,
You should come to Istanbul again.
yeah. I miss Istanbul so much. Anyway, I wish everybody here had understand a little bit about jaw functional orthopedics, and if you want, everybody that are listening to us want to go to the Instagram, Dr. Patricia Valerio, and you can talk to me in the direct, no problem. I am always answering the questions because it's a pleasure to me. My Instagram is a professional Instagram. Okay, so if someone that is listening to us wants to talk about some subject, I'll be glad to answer. Okay, thank you so much for everything.
I am very happy to see you that you are very active in social media. You are very, very familiar with digital technologies.
Yeah.
It is very great for us. So, dear colleagues, Dr. Professor Valerio is very active in social media. You must follow her. You should ask questions. Thank you very much. Hope to meet you again. We are very honored to meet you. Thank you very much.
Bye-bye.
Thank you. Thank you very much. Dear colleagues and friends, we will make the third episode with Dr. Lawrence Yanover, a great clinician, a highly eminent name of a wise man of pediatric dentistry. 2 weeks later, on 17 April, Wednesday. So we would like to meet you in CPD Talks again. We again thank to dear Patricia Valerio. I have three special thanks to three special men, my dear friends. Firstly, Dr. Kaan Satash, he was my student. Now we are doing a great job with him. The second one is my dear friend Mehmet Ali Kurt. I have special thanks to him for his great effort for the CPD talks. And finally, Fatih Teke, my dear friend, he has made a great contribution for the development of CPD talks. I would like to thank to my friends. So hope to meet you on 17th April with Dr. Lawrence Yanover. Bye-bye.